What I wanted to do is first first of all, thank you for joining us. And I think first we'll go over what was in the governor's announcement today. I have a few thoughts that I'd like to share about that. And then I'm going to hand it over to Dr. Mendoza to give you some thoughts on the where we are with our numbers and what he's seeing. And then we could take some questions that you might have. First of all, today was a continuation of the conversation that we had on Friday, last Thursday, and again in the last several weeks. Our cases in Monroe County have been on the increase. The number of positives have been increasing sharply over the last several weeks, as well as our positivity rate has started to increase as well. And it is clear that we are experiencing community spread in Monroe County pretty much throughout most of the county. And it's not really targeted to one particular zip code, one particular neighborhood, but we're seeing it in a lot of places, particularly related to groups of people who are getting together, who are unrelated, outside the same household without wearing their masks. And what we're seeing is that it's really not uncommon for a contact tracer to be calling somebody who turns up positive, and then when you ask them, where have you been over the last couple of weeks, to find out we're at a house party with 10 people, 15 people, and nobody was wearing a mask. That has put us on the wrong trajectory. We need to now start to take measures to put us back on track, to start to flatten and lower that curve back down. What the governor announced today is a strategy that I know has worked in other places. And what the strategy is intended to do is to understand that the last thing that we want to see, and the last thing I want to see, is the cases continuing to go up. I want to avoid a shutdown, and I think all of us do. And what we want to continue to see is us be successful and stay on the right track. Keep our businesses open, keep everybody, keep the businesses open, keep the schools open, and keep us on the right track. What was announced today, I think, are reasonable steps to help us get there and avoid the shutdowns that we saw earlier this year. So let's talk about what was announced today. The map was just released a few minutes ago. I know it's a little hard to see online, so I'm going to go ahead and read what the towns were. I know last week we were talking about zip codes. Instead of identifying zip codes in a yellow cluster, we instead decided to go, and the state decided to go with municipal boundaries to make it easier to follow and easier to track. So the yellow zones in Monroe County are the city of Rochester, the towns of Greece, Irondequoit, Webster, Penfield, Perrington, East Rochester, Pittsford, Brighton, Henrietta, Chili, Gates, and Greece. So again, city of Rochester and the towns of Greece, Irondequoit, Webster, Penfield, Perrington, East Rochester, Pittsford, Brighton, Henrietta, Chili, Gates, and Greece. As a result of that, in the yellow zones, there's a couple of changes, and I think, again, like I said, I think these are reasonable steps to help try to mitigate and control the spread. The first one is to lower the number of people at a gathering from 50 down to 25. I think 50 is something we've gotten used to over the last several months. It's going to go down to 25. And restaurants and bars are going to see a change in that the state's going to restrict their operation so that they close at midnight. So they're not closed, but they have to close at midnight, but they can remain open in other hours during the day. And they're also restricting dining to a maximum of 4 people per table, again, in an effort to limit unrelated people from different households being in close proximity without wearing a mask. There's also a new requirement in terms of the schools that would require 20% of the students and faculty, pretty much everybody inside the school building, for in-person learning and attendance, 20% to be tested weekly. And I'll have Dr. Mendoza talk about what that looks like. Now, the testing within each in each one of those school districts is something that, and I'll tell you the way it works, then he could talk about the test. The way it works is that the state will provide the testing kits to the County Department of Health, and the County Department of Health will then distribute those testing kits to the local school districts based on their need. The local school districts, though, will manage the testing process, and they'll manage all the details around that. So that's something that will be made available over the course of the next days and weeks. And that's something we'll work with the school superintendents on. Dr. Mendoza and I just had a meeting with the school superintendents this afternoon to discuss that and to help work through that process. So those details aren't available yet, but they will be available in the coming days. I know there's going to be a lot of questions about how that will work, but we'll get there. In terms of when the order is effective, I have not seen the order yet. It may happen here while we're speaking, but I haven't seen the order yet. It'll be effective once it's signed. So I assume that will be any time now. And then in terms of enforcement, I know there's been a lot of questions over the last several days and weeks about enforcement. The Monroe County Department of Health has been enforcing orders right from the beginning, back in March. In terms of the shutdown and the reopening. We're redoubling our efforts, though, and are asking for the public's help. Our COVID hotline is still open. It's at 753-5555. We also have an email address, covid19@monroecounty.gov. If there are issues that need to be investigated by the Department of Health concerning large gatherings, if there are businesses that are operating outside of the guidelines that are issued. Again, we have our hotline 753-5555 and the email address covid19@monroecounty.gov. Complaints or issues can be raised through those avenues, and then they can be investigated by the Monroe County Department of Health. So now I'll hand it over to Dr. Mendoza, who could talk about our numbers and what they're seeing today.
Thank you, County Executive, and thank you again to all of our partners in the media. I know you all have had a busy weekend as well. So a lot has happened since Friday. On Friday, I spoke of COVID apathy, of pandemic apathy. I spoke of a slippery slope that will be hard to turn back from. The data over the weekend underscore the very seriousness of this problem. By my count, we've recorded an additional 467 cases just Saturday and yesterday alone, and nearly 30% of those are in the age group of 20 to 29. 30% of all of our positives are in that 10-year age group of 20 to 29. Our 7-day rolling average of positivity has been steadily trending upward to the point that it is now at 3.4%. And as you heard from the County Executive, that now earns us the classification of being in a yellow zone. I want to underscore what that means. We were once upon a time, not long ago, among the best counties in the country, and now we're in the yellow zone. We have shown that we have a lot of work ahead of us. I am optimistic. I know that we can do this, but we need to change our course. Quite frankly, I am worried about where this is headed. I worry for our community. I worry for all of the hard work we've put in the last 8 months. And I would hate to see all of that hard work, all of your hard work be for naught. We are in the yellow zone now, and the orange zone is not that far away. And the orange zone is further along that slippery slope that I don't want any of us to have to experience again. So now is the time. We need to buckle down as a community. We need to get this together, because if we don't, my worry is that we'll end up somewhere near or at where we were earlier this year. We are learning, particularly over the weekend from contact tracing, that Halloween was a problem. A lot of the positive cases that we are now uncovering are traceable either to events that people called a Halloween-related gathering or gatherings that occurred over the holiday weekend, the Halloween weekend. And obviously that gives me great pause as we look ahead to Thanksgiving, which by every measure is a much more social, perhaps one of the most social gatherings of the year. We are now just over 2 weeks away from Thanksgiving. Now is the time for us to buckle down and to do everything we can. And that may mean reconsidering our Thanksgiving plans. Now, nobody wanted to be in this position, and sadly, here we are. So now is the time to be looking ahead. We will threaten the holidays over the December month if we do not pull this together in time for Thanksgiving. Again, many of these gatherings are in private settings. Bars and restaurants play a role insofar as that they may be places where people go to start their evening. But in general, these 18 to 21-year-olds are going home after they go to restaurants or other public places and are gathering without their masks on, typically in a private setting. So now is the time we need to get this together because, as the county executive said, we want to do everything we can to keep our schools open. As I've said before, and I'll say it again, our schools are among the safest places to be from a COVID transmission standpoint. And sadly, they stand the most to lose if we as a community do not pull this together now. So as the county executive mentioned, we will be beginning testing, and that is a good thing. The testing prevalence in our schools will be very important in offering data to us as we decide how to proceed in the coming weeks and months. The testing is the less invasive form of testing. It's not the nasopharyngeal swab that many of you have already had. It is a shallow, rapid test that does not go all the way into the back of your nasal cavity. It's more of a shallow test. And the expectation will be that 20% of the in-person students and staff, so that would be anybody who's going into the schools, whether it's hybrid or full in-person, will be asked to have this test. 20% of that population going forward every week. So that at the end of 5 weeks, everybody eligible will have been tested. This will give us important surveillance data in the schools and will allow us to have better understanding of what the community prevalence is, which, as I mentioned, is increasing up to 3.4% now on a 7-day running average. So now is the time we need to get together again as a community. We now have a curve that we must again flatten. Now is not the time to fall prey to COVID apathy. So with that, I will turn it back to the county executive, and I think we'll take some questions.
Great. Thank you, Dr. Mendoza. And one of the things I'll underscore to the community is that we did a really great job earlier this year when our curve was starting to go up and we were starting to receive more and more cases, and working together as a community to understand that how we protect ourselves and our community from COVID-19 isn't a personal, it's not always just a personal selfish need, it's a community need. So you wear a mask not just to protect yourself, but it's to protect people around us. And the actions that we all take today will inform what the community looks like 2 weeks from now, 3 weeks from now, and into the winter months. So as we all double down our efforts right now, understanding that we're now in a yellow zone designation, which is really just the beginning stages. It's a warning sign that we're heading in the wrong direction. It's a warning sign, and it should be a wake-up call that we all need to double down on our efforts to wear our mask and practice good social and physical distancing techniques. If we can do that as a community and work together as a community, we will get through this. We will avoid getting into the orange and red zones as other places around the state have done. We're not the first by any means community to be in a yellow zone. We probably won't be the last, but we can do what other communities have done and turn our numbers around and get back out of that yellow zone. But the only way we're going to do it is if we follow the recommendations. And I know and I have faith that everybody here listening to my voice can do that. I have all the faith in the world because we did it earlier this year. We did it successfully all summer long. And I know we can do it again as we head into these, particularly because we want to have a good Thanksgiving. We want to have a great holiday season. And we really, really desperately want to keep our schools open and keep our young people safe. And in order to do that, the actions we take today will inform how we're able to do that into the future. So with that, we have some time to take a few questions that the media might have.
Okay, first up is Tanner Jubinville from 13 Web.
Hi, good afternoon. First question would be testing in the schools. You said the state's going to be helping to get the county rapid tests, correct?
Yes.
So how exactly, I guess, what types of conversations are you having with districts to make this all work? I mean, that's a lot of tests.
Yep, it's a lot of tests. Our estimates, it'll be about 15,000 tests total that we'll need to do per week. So that's obviously a large volume. We have been, as you know, in very close conversations with our school superintendents just in the last hour, and then I have another conversation or two with them later on today. We are working through the details. There are a whole host of regulations that we're familiar with that I spoke to them about even last week. But all of those details are still yet to be ironed out, but we are working on them feverishly.
And during the conference call with the governor this morning, he mentioned again tougher enforcement by localities. I know you brought it up, Adam, I believe, but Is there a point now that we've moved into this yellow zone that we move away from education over enforcement, as we've heard time and time again?
Well, yeah, the hotline is there, 753-5555. And we have been enforcing from the beginning. We haven't seen what a lot of other communities have seen, though, in terms of a blatant disregard from the rules. Particularly, we've had really good participation from our bars and restaurants and our business community. But enforcement now is going to become, we're going to have to start to see that more if we start to see violations like that. And we need the community's participation in that. We need the business community participation in that. But again, it's not meant as a punitive measure. It's really about public safety. It's about protection of our community and make sure that everyone's doing the right thing. And by and large, we've had great participation. What we're seeing more of, though, when we get our positive cases here, we're not really seeing it, as this particular business is a hotspot spread or this particular park is a hotspot spread. What we've seen in our experience here is that it's coming from small gatherings of people who don't normally live together. So we're seeing gatherings of people, 10, 15, 20 people, not wearing a mask. And we just need to be cognizant of that. So if you're around friends, if you're around family that you don't live with, you have to wear a mask. Keep a physical distance, a 6-foot distance, so that we prevent that spread from those groups. I'll just say over the weekend, I went by I saw kids, I went by a park, saw a couple dozen kids playing with each other, very close contact with no mask. It's a very easy thing and a selfless action to put a mask on.
Thanks, Tanner. Next up is Patty Singer from the Minority Reporter.
Hi, I want to follow up on the enforcement. How do you enforce these private gatherings? I mean, we can drive down the street, not have a seatbelt on, quick it or ticket. We get stopped, we get a ticket. Same thing with speeding. I guess what is the point where you take that approach, which is still public health and public safety, into this and what we're dealing with COVID?
It's a very difficult thing. And that's why we need the public's participation and cooperation. It's very difficult. Earlier this year, when we had our initial shutdown, our initial spike, we had really good participation from this community because everyone realized that their actions don't just affect themselves, but it affects the greater community. And now that we're all in the yellow zone, or most of us are in a yellow zone, we realize the actions that we're taking. It's very difficult. It's very difficult to enforce this in a private setting, in a private residence, something like that. So what we're asking for is the community to participate again, just like we did earlier this year. Because to your point, that is difficult. But we did it before. And so I'm confident we will do it again. And we just have to make sure that we get back to the basics of what we know works. And recognize that part of being a good citizen is not just protecting yourself, but it's protecting those around you. And so I would just ask everyone here that if we want to make sure we're still going, if we want to go back in the right direction, we want to get off the track that we're on. We're in the yellow zone now. We want to get back on the right track and back in the right direction. There are simple things we can do that we know work. We know this works. Wearing a mask works. Keeping a 6-foot physical distance works. We also need to engage in more testing. Dr. Mendoza talked about the testing in the schools. There's also the availability of testing at MCC, and this whether you have symptoms or not. It's free to the community. There's no charge. You just call the hotline or go to the website. It's available. It's linked through on our county website at monroecounty.gov. Anyone can go and use the drive-through testing site at MCC. And that will help us in what they call community surveillance to be able to identify these cases, zero in, and get people isolated and quarantined.
So let me offer an additional analogy, and you all know with the work that we do in restaurants. When we inspect a restaurant, we look for procedures, we look for equipment, we look for all the things that have to be in place in order for a restaurant to be safe to serve food to the public. The one thing that we do not observe and cannot observe is what the people do, when we're not there, and B, when we're not looking. We rely on our businesses to do the right thing. And by and large, our restaurant community has risen to the cause time and again, and they have throughout this pandemic. And it would be easy, if you want to use that word, if the problem was in restaurants, for us to inspect and fine and do all of the things that we know how to do. But the reality is that the smoking gun is not our restaurants. It is generally not our businesses. The smoking gun is beneath our nose in all of our homes and our basements and our backyards. And while it is simple, stay home, with your household and try to limit your outside gatherings and the size of your gatherings, it's hard to do. And we're 8 months into a pandemic fatigue that is difficult. And so I get that, but as I see it, we need to be serious about this, because as I see it, it's pay now or pay later. And the reality is that we can do this. I know we can do this, but it does mean that we have to shift our mentality and really balance how we look ahead to the weeks and months to come.
As a quick follow-up, at the beginning of this, we had Protect Your Circle. There seemed to be a lot more public health education style messages put out there. If there is this fatigue, how does that message have to change so you're hitting the ears with a different message and it sounds new, and then people may be more compliant if you don't want to click it or ticket if someone's not wearing a mask?
Well, Patty, that's what we're doing today. And that's why we're in a yellow zone designation now. This is a wake-up call for the community. It really is. And that's why we're here telling you this is what the spread looks like. This is how it's happening. And, I'll underscore something that Dr. Mendoza said. I know we're saying it over and over again. We can do this. I mean, we did it once before, several months ago. I have all the from the world in this community, in this county. We have done this. We've done a great job. Before. We will do a great job again. We'll get through this. I'm going to borrow a line that I think I heard the governor say earlier, which is that, we may be tired, but the virus is not. It's still spreading here. And we have to be vigilant and we have to be smart, but we're going to get through this. This too shall pass. I mean, there will be a day, hopefully in the not too distant future, where we won't have to wear masks and we're not going to have to keep that physical distance, but we need to get to that day, right? That's the goal. That's what we're all striving to do, is get to that day. And we want to get to that day while keeping as many of our fellow residents employed. We want to keep the businesses operating, and we want to keep our children in school and keep them educated. And so I think that by participating and underscoring the message that we have to wear a mask, we have to follow the regulations, we will get there and we will be successful. But we have to protect our community and put the safety and health first.
Great, thanks, Patty. Next up is Jennifer Lukey from WHEC.
Hi, good afternoon. Dr. Mendoza, I wanted to circle back on the testing in schools for a moment. I know you said it's a little bit less invasive than maybe what some of us are used to, but there will be parents who will not be comfortable with that. What would your message be to them? And also, this will be, just so I'm clear, up to the schools to administer these tests on the students and staff?
Yes. So this test is much less invasive. It does not go all the way to the back of your throat. That being said, I respect that if parents have concerns, that we want to address their concerns. We want them to ask their questions. And if ultimately they absolutely refuse, then we'll have to figure that out on a case-by-case basis. But my hope is that that won't be the case. My hope is that when we show people how this test is, you do not need a nurse or a medical professional to administer this test. This eventually could be the test that is used as a self-administered test for people, because it's that straightforward to do. So this is new. I understand that things that are new represent change, and change is difficult. But my hope really is that this is not going to end up being as invasive or as complicated as I think people fear.
And I know I've been asking a lot about enforcement lately. I'm going to take the other side of this for a moment and say, Dr. Mendoza, do you really have enough people working to go into restaurants and ask if there's 5 people at a table versus 4? I mean, how realistic is it to enforce some of this? I know we talked a lot about those indoor gatherings in the privacy of people's own homes. I'm assuming you don't want calls to that COVID hotline where people are saying, I think my neighbor has 27 people instead of 25. So what is the realistic way to enforce here?
So, we'll handle that on a case-by-case basis. There are restaurant inspections that there aren't deadlines for. And, I've been preparing, sadly, for this day. And so we've tried to get ahead of our restaurant inspections so that come year end, we're not relying on the last 2 months to get them all in. So, we are a little bit ahead of the game in terms of the restaurant inspection business. But the sad reality is that we've pulled a number of our restaurant inspectors into the COVID operation. So this is a balancing act. And honestly, it would be a lot easier if people just did the right thing. But that is unfortunately the challenge, is that we have to prepare for both. And, we have flexibility. We've been cross-training our staff since I got here 4 years ago, because we know that, in any given crisis, we need to float people from one thing to the next. And so this is what we've been planning for, preparing for. And yeah, absolutely, it's tough.
Great, thanks, Jennifer. Next up is Kelly Green from WROC.
Good afternoon. So I have another question going back to the school testing. If you know this answer, how will students and staff be selected in that 20%? How will that work?
So that's a process that the schools will be figuring out. It's 20% in any given week, but the logistics of that are not specified yet. So we'll either hear more details on that from the governor's office, or it'll be however the schools decide they want to implement it.
Okay, and in regards to the orange zone, so if things continue to worsen, how fast realistically could we get there, and what would that mean restrictions wise?
Well, it's all driven by your positivity rate. And so I'm hoping it doesn't get to that. And I don't think it will. I mean, we're all going to participate and get our numbers back down. But if you hit the designation for the orange zone, it further restricts things like the mass gathering restrictions. It'll take it from 25 down to 10. And then it will also trigger that conversation about what non-essential businesses can remain open. And it will also then trigger the conversation about schools as well. So I don't want to get to that point. I don't think anybody here does, but the positivity rate is what's important here to keep an eye on. Yes, our numbers are going up, so as our testing numbers are going up. So it's really the rate. Right now, I think Dr. Mendoza said we're at 3.4%. If we can keep it in that range and start to lower it, then we will avoid the orange. This will be, and again, this is based on also the rolling average. So you might have spikes that occur. We don't really look at or feel too alarmed when we see a spike on a day because they come back down. What we like to look at is trend lines.
Okay, thanks, Kayla. Next up is Steve Orr from the Democrat and Chronicle.
Thank you. Hey, Dr. Mendoza, you said a minute ago, you talked about restaurants and how most of them do the right thing in terms of cleanliness and running a good operation. And they are altruistic, I'm sure, but also they know that if they don't do the right thing, that you will fine them, or you may show up and slap a big ugly sign on their door and shut the place down. So the question I have for you is, if we're talking private gatherings that you would learn about through happenstance or through neighbor complaints, has there ever been an occasion where the county has fined the host of a private gathering?
No.
Of a wedding, of a party, of
no.
Anything?
Have I thought about it? Absolutely. But the reality is, as you all know, that's not the first tool I pull out of the shed. We want to educate and give people the benefit of the doubt. Now, I think, you can't give people the benefit of the doubt too often, because these rules are not, secret anymore. These guidelines have been in place for months. So, we are looking for people to do the right thing. But the reality is, if we hear of a complaint, we will call our law enforcement colleagues and talk through how to manage a situation. We do not want to hear about parties of 100 happening at all. I think that would be very unwise. And that puts the entire community at risk. And my hope is that people will look beyond themselves and look beyond, the pleasure of a weekend and a gathering to say, well, what's really important as a community? We want to keep our schools open. We will threaten our schools by being careless in this way. And I don't think anybody really thinks that having a party of 100 people is worth the consequences that might have on schools and the school students' education and mental health and so forth. So, we need to be thinking not just as restaurants, but as a community about the greater good.
Thanks. If I could, real quick, on the schools. I know you said last week that they were paragons, that they were doing exceptionally well in terms of transmission within the school buildings, virtually none. Would not this testing regimen be better applied somewhere else? I mean, you're essentially testing in a place where you believe there's very little coronavirus, right?
Right, and the hope is that that will bear out when we test, that we will not see those large numbers. And I think, though, that children in schools are a barometer for the community. And if we are seeing an increase in the schools, then it has to be from their older siblings and their parents and their other, gatherings. So I think that this is a convenient barometer, if you will. But absolutely, we want to test the community at large, and that's why we're encouraging people to go to MCC to see their healthcare provider and so forth. But testing in the schools in this asymptomatic way is part of doing community surveillance. And we have many kids representing many, many families, and it will give us a good sense of what the baseline prevalence in the community looks like.
Thank you.
Great. Next up is Jeremy Moule from City News.
So the sort of the changes that come along with the yellow zone don't seem like they're really that different from what's been happening here now. Do you guys think that that they are going to help get the numbers down, or is it more on individuals to do that?
Well, I think it's helpful. And Jeremy, I also look at this as the yellow zone designation. I also view this as a wake-up call and a call to action from us. The way the virus impacts our community and spreads isn't some outside force that comes in and says, okay, regardless of what you do, you'll be at 4% next week, 5% the week after, 6% the week after. It's a wake-up call that how the virus spreads in Monroe County is entirely up to us. It's entirely up to us. And looking at then the gathering sizes from 50 to 25, you look at limiting 4 people at a table at a restaurant. You look at testing in the schools. All of those are warning signs. All of those are geared towards what those warning signs are. It's the gathering of people who are not from within the same household who are getting together without a mask. So I think this is useful. I think it's a wake-up call, but I also think it's a call to action to get to a result that I know we can achieve. I know we can achieve it, because at the end of the day, we're all going to make that determination. What would we rather see? Rather wear a mask or close things down? And I know we don't want to wear the masks anymore, but if wearing a mask keeps the schools open, if wearing a mask keeps our businesses open, if wearing a mask keeps us employed and going to work, then we will wear a mask. We did it before, we'll do it again.
And just one other question. The maps that you released, or the list of towns in the city that you gave us, how are they selected? Are they the ones that have like a certain positivity rate, or is there something else that worked there?
No, it was an analysis of the positivity rates, and the conversation, if you recall, going back last week, was zip codes. I announced a number of zip codes last Thursday that were looking problematic. The conversation shifted a little bit, and the determination made by the state was that instead of looking at zip codes, which can be arbitrary, you're looking at zip codes within a certain town, you're looking at it within the city of Rochester. Instead of having those type of arbitrary lines, I think it makes a lot more sense to look at it with municipal boundaries. So the state made a determination to do municipal boundaries. That's how they did it here in Monroe, Erie, and Onondaga as well.
Remember, when you look at the positivity and where the cases are, that doesn't necessarily mean that that's where those individuals contracted the infection. So it makes sense to look at this from a community standpoint, because we're all one community. And if we hone in on my zip code, for example, well, then people are smart enough to go to another zip code to do whatever they want. So I think it underscores the fact that this is an all-in community effort.
Great.
Thank you.
Next up is Noelleevans from WXXI. Muted.
Okay. I think we can go to.
Okay, we'll go to the next one, Jonathan Hunter from Spectrum News.
Sorry, can you hear me? This is Noelle Evans with WXXI.
Hi.
Sorry, I didn't realize I had just spoken to myself. I was muted.
Okay.
So apologies. I'd like to know how long you think it may take if people do follow these guidelines for us to get out of the yellow zone.
Mathematically, we could be out of the yellow zone at the end of the week, but we would have to really turn things around with the rate of 3.4%. You know, I'd have to look at it, but mathematically it's possible. I think it's somewhat unlikely, but you know, I think we'd have to look at that rate. We'd have to look at the 7-day rolling average, and you know, to get out of this zone, I have to look at the numbers. But I think mathematically we could probably do it, but it would take a large effort on the part of the community.
Okay, and just a follow-up. I mean, as you mentioned about Thanksgiving coming up, when we talk about the sort of pandemic fatigue, one of the ways I viewed it personally is that people have a need for socialization and a need to connect with other people. I've seen that help folks who have, you know, mental health conditions, and I've seen it help people just in general when they're recovering from, say, a surgery. So I can see how it is a health benefit to be able to connect with others. And I wonder if you have any messaging for people who do need their support systems at the same time that they do need to follow these guidelines.
My advice is to do it safely. Very simple. We've been talking about this for months. Nobody wants to isolate us from one another, and we can get together safely. You know, virtual ways are obviously very safe, but even, you know, in person with distance and wearing masks, we know that that works because we have hundreds and hundreds of examples every day where it does. You know, individuals in whom we are able to prevent infections essentially because we know that they were properly distanced and wearing their masks. So nobody wants social isolation, and that's never been something we've advocated for. But again, we need to be careful about how we gather and do so safely.
Thanks, Noel. Next up is Jonathan Hunter from Spectrum News.
Hey, how's it going? Just want to talk about, I guess, testing. Some of the things that we have heard from our end is that there's been, I guess, a little bit of a backlog in testing, where we talked to some person and they were saying that, well, last week they were able to get the results rather quickly, but now it's taking a little longer. Can you talk about the backlog? Are you guys seeing things or addressing it?
So from when we look at the numbers, I'm not seeing an overwhelming backlog at all. And in fact, MCC is under its prior capacity. They can test more people than they are currently testing right now, which isn't to say that things don't happen and that some things don't get delayed. I know that that happens as well, and we want to work on that because that matters too. But the overwhelming experience is that tests come back within 2 to 3 days.
Okay. And just one follow-up question. And we talked about, I guess, the yellow zones, and you listed out all the towns. And there are a couple towns that are not on the yellow zone. Are they, I guess, assuming they can operate like under normal circumstances, and you're hoping that you don't have to put them under restrictions as well?
I'm sorry, Jonathan, can you say that again?
So when you guys gave us the list of all the different towns, as you listed out all the different towns like Penfield, Webster, Rochester, there are a few towns in there that aren't under the yellow zone. Are you hoping that those towns don't stay on the yellow zone, or they can operate, you know, the normal way that they've been operating now?
Yeah, so my understanding from the order is that the changes are only reflected inside towns inside the yellow zone. But the message is the same for the whole county, okay? Is that we have to get back to the basics and follow what we know works and follow the science. So what we're announcing, again, it's only going to pertain to those in the yellow zone. But you know, like Dr. Mendoza said, just because you live in this town or zip code doesn't mean you didn't contract it in another one. So we really need to view this as a community-wide issue. Also, frankly, because we also want to prevent those that aren't in a yellow zone from falling into one in the next couple of weeks.
All right, thank you.
Everyone? All right. Great, thank you. I think that was everyone. Thank you again for tuning in. And like I said, you know, I feel like I'm on repeat here, but like we said a lot today, let's continue to work together. I have all the faith and confidence in the world that we are going to come out of this. We're going to do it just like we did earlier this year. We're going to do it now because I know we want to get back on the right track, keep our businesses open, keep our schools open. And to do that, we just have to take this seriously again and make sure we're wearing our masks, keeping a physical distance of 6 feet. And we'll get through this and back on the right track. So thank you all very much.